Thank you very much. Good morning, good afternoon. I know we have people from 4 different continents, so I do not know where we are in the day, but one thing which I can guarantee is that it's going to be an exciting day. We have an amazing panel that brings together some of the experience and wisdom of community-led monitoring and digitizing. So I'm really excited. Quick introduction. My name is Pradeep Kakatil. I serve as the head of the Health Innovation Exchange. I'm really grateful to the panelists and to all of you who are online today. Maybe some quick housekeeping rules. For those of you who would want to follow us in French, we do have a language interpretation real-time happening. So if you want to follow in French, you can go to at the very bottom of the screen towards the right-hand side of your screen. You'll see the image of a globe. Click on it, and you will be able to follow it in English or French. So please feel free to follow us. We have some, I also want to thank the interpreters for being there and translating this. Number 2, we want it to be a really interactive conversation. This is a conversation. Please do use the chat function, and in the chat you will be able to put in your questions, and I'll make sure that we take in as many questions, as many comments and suggestions as part of this conversation. So maybe as part of the first thing that we would love you to do is say hello and tell us where you're coming from. Tell us your city and your name. Your first name is good, so please do that. Would love to say hello to everyone and recognize all your presence. Thank you for joining us. Maybe just a very brief introduction. Yes, and the other thing which we would love you to do is there's a little poll that we are running. We just want to see how we can really be supportive of the work that you're doing and how we can really engage with you. So there's a poll that you can complete here. Please do use a few seconds. I know all of us are multitaskers, so please do use this to respond to the poll. I can already see several responses. Thank you so much. I don't want to take too much time providing a background. You're all the experts. I know we have an amazing panel of experts, and many of you are working on CLM day in and day out, and there's a lot of experience that you bring. My own journey has been, I started working on HIV in '91 when a very good friend of mine tested positive for HIV, and I've worked on HIV since then, including being a UN bureaucrat for several years. But what I've found is that when we really put the power of information at the community level, and if we can really, that becomes an accountability tool, but it also becomes the most critical tool for ensuring quality people-centered services. And that's really the journey of the AIDS movement. So that's why I'm really excited about the conversation around CLM today. What we want to achieve today is absolutely share the experiences. Where are we? What have we learned? What are the challenges? And how can we really leverage the power of digital for scaling access to quality services? But at the same time, we also want to see how we can support each other through the whole journey of digitizing CLM. And there are so many lessons. And also to look at what are the tools that will be necessary for us to make that journey. So having said that, let me turn to Linda Mafu. Linda, you don't need any introductions. If I may ask you to have your video on, you know probably most of the people in this room, and almost everybody knows you. So thank you very much for joining us. Linda, for me, I've seen this real emphasis emerging from the Global Fund strategy and from many of the work that you've been doing on the power of CLM and digital. So it'll be really great for all of us to hear where do you see as Global Fund, what does your strategy say? Why digital in CLM now? How can we leverage this? What's your guidance to all of us who are going through the process of the GC7 process, and how can we leverage the power of digital as part of this process? So Linda, over to you.
Thank you so much. Thank you, colleagues, for the invitation. Also to be just part of this important dialogue and conversation, and it's a conversation. The Global Fund Partnership developed a new strategy, which has 4 strategic objectives. And key to that is the community-led monitoring that is contributing to about 2 of these pillars of objectives. The first one is maximizing people-centered integrated systems for health to deliver impact, resilience, and sustainability, and that's very important. The second pillar is maximizing the engagement and leadership of most affected communities to leave no one behind. This is very important for us, and it's our objective, and we will be evaluated in terms of achieving these objectives. And part of that is to make sure that we have a really robust community-led monitoring program, but also a digitalized community monitoring program. So for us, CLM helps to collect, assess, triangulate data as well as observations that are both quantitative and qualitative. And they are all essential for program oversight, to improve policies, to improve procedures, but also, most importantly, for health outcomes. Communities and civil society usually collect data as part of an independent monitoring activity, which is very important because we know that communities speak more freely when they are talking to other community members. And therefore, when they are talking about their experiences and the quality of services in their healthcare facilities, it's a safe space, it's a free space for them to express them freely. And that information is then used by communities, by civil society, to ensure that they provide evidence, but also the advocacy is based on the data that is collected from communities. So that is very important for us at the Global Fund. We know that civil society communities are very critical voices in advocating for human rights, for gender, for inclusion of key population and community system strengthening, which is a very important element of the Global Fund strategy 2023 and 2028 to 2028. For this to be effective, the community-led monitoring needs to be entirely independent and driven by communities, driven by civil society. The efforts and the actions have to be developed and led by community organization. It can't be led by health systems. It can't be led by government. It has to be led by communities. We know that when we're talking about community-led monitoring, the focus is on availability, accessibility, affordability, acceptability, and the quality of service. That for us is important. Therefore, if we are now looking at the grant cycle 7 of the Global Fund, it is important that civil society and communities are at the center of discussing some of the key programs, because if that's an opportunity. So for us, we see the grant cycle 7 as an opportunity, as a process, as a platform for civil society to lay out the priorities, to lay out the needs, and to influence the design of and the implementation of the grant cycle 7, starting at country dialogues, funding requests, to grant making. So the whole process, it has to be influenced by civil society. Therefore, community-led monitoring needs to be the key pillar in the country dialogue, and also forms part of the fund request. Why are we looking at digital solutions for community-led monitoring. The Global Fund's 2023 to 2028 strategy, fighting pandemics and building healthier and more equitable world, acknowledges the growing importance of digital health and its role in improving health outcomes for HIV, TB, and malaria, as well as strengthening health systems. And one of the major investors in health system is the Global Fund, particularly for the continent. The investment at the moment is at an average of 280 million per cycle in terms of the data science and digital health. The Global Fund is committed to make sure that the community-led monitoring is a success, and also understanding that it is critical for community system strengthening and promoting evidence-based decision-making that keeps affected communities at the center, because that is one of our key areas for us. Global Fund has also provided support working with private sector and launched the Digital Health Impact Accelerator. That is another big area of focus for Global Fund, particularly for the sub-Saharan Africa. For us, we have learned a lot from COVID-19 crisis, and also we have learned a lot in terms of how important the engagement of communities and a robust engagement for a impactful response at community level is very important. So for us, we see the grant cycle 7 as a very important opportunity to advance the digital community-led monitoring agenda. And we look up to civil society to continue advocating for that to be included in the fund request, to be included in their countries, to be funded so that they can carry on the work and influence the programming and the outcomes of the programs and outcomes of the health for communities to really enjoy and leaving no one behind. So lastly, from my end, Global Fund is committed to ensure community-led monitoring is supported and embraced. It is also committed to make sure that the community-led monitoring embraces the power of innovation and technology for impactful health outcomes. We are all about making sure that the quality of service is in a very good quality for everyone, but also making sure that the health outcomes is enjoyed by everyone in terms of the communities that we serve. So thank you so much for listening, and I'm looking forward to this rich dialogue.
Linda, thank you so very much. I think it's always inspiring to hear you speak about and framing the issues so beautifully, because it is really about, it's about systems, but it's also about people. It's about quality, but it's also about accountability. It's about the dialogue in country, but it's also about investments. And you touched all those issues so beautifully. Thank you for that. What I'm going to do is for anyone who has questions for Linda, please do use the chat. I do know that I saw some of the chat. Unfortunately, because of the numbers here, we could only use the chat, but please do use that and we'll see how we can bring those questions in. But let me, while we wait for those questions, and I want to make it interactive, I want to make sure that we are going back and forth. So we will be going back and forth in terms of the conversation. So let me move to Sungang. Gang, you have been one of the key actors when it comes to supporting countries in the whole health system strengthening, looking at resilience of systems and moving the agenda. And you have been really now focused on supporting the GC7 process in countries for the Global Fund Grant 7 cycle. And you're supporting countries. And coming from the AIDS movement myself, I always believed that HIV has been the driver for system strengthening and putting people at the center. The question I have for you is, what is UNAIDS doing in support of countries and communities through the GC7, particularly for CLM and digitizing of CLM? And the second question that I have is, what can partners come to you for if they need, how can they come to you if they need some technical support for doing that? Over to you, Gang.
Hi, thanks, Pradeep, for this opportunity that we can share some of our experiences in the supporting countries to roll out of the CLM. As Linda said, has been one of the very much recognized new areas of work, probably even can be considered as a game changer because it stays so well, I mean, in the overall principles in dealing with HIV, dealing with TB, malaria, but also the potentially also contribute to addressing many other health challenges and problems. Because at the essence of it, the CLM is focused around that people, it's around the people that we are serving, right? So actually it's help in a very concrete way of getting the true feedback from the recipient of the services. So in that way, the data not only being collected, not being only analyzed, presented, shared, but actually leading to advocacy and to real change of improving service provision and the improve the quality of all the services are being offered and being actually financed by the government, by key donors, and by all. And that also echoes very well with probably people well familiarized with the term of GPA principle, great involvement of people living with and affected by AIDS at all levels. So in that way, that for the very common sake of making the service work, if I also type on what the term Linda used to see the impact there. So actually, your question referred to, I see two layers. One is how CLM could contribute to the health systems strengthening, and also how UNAIDS are playing its role and what support we are offering to partners. I think, well, thanks actually for this good forum that you are inviting the people from all different parts of the world, and then they actually carried a lot of experiences. I'm so glad to see that we have our country direct from Nigeria, Leo are there, and we have Inaso, we have people from South Africa, from all different countries are here, which actually are implementing and making things work on the ground. I hope they will also have more chance to add on into those issues. But the talk about health system strengthening, we cannot avoid probably tapping on the 6 building blocks, which are leadership governance, right? I mean, supporting the service delivery, the health workforce strengthening, health information, access to medicine, and improve financing. And it's very interesting to see that from what we have observed, CLM actually contributing to all of this. And it also we are currently working on a global landscaping report, which are also trying to capture the good result coming out of the nice practice from all over the world. So many countries actually through their good work of the community groups, which are actually leading the community-led monitoring and are actually showing that CLM can actually reinforcing the accountability of all the HIV program in the first place, but also, I mean, could contribute to many other programs as said. It is a good example of reinforcing the inclusive governance. So in that way, the CLM data, once being collected, being analyzed, and hopefully you are offering a more the robust digital tools that can even more empower of this kind of the CLM initiative to be timely, more accurately reflect what things are happening, and then this feedback loop will be running more effectively to lead to many other improvements. And this will be in the first place of improving the service delivery. For example, that we know that there are human rights, the violations or the concerns or the discriminative attitudes by some staff are preventing people, particularly those living with HIV/AIDS, or I mean people from the most the marginalized group to access services. And those things are being being reflected through the CLM, reporting. We see in all countries where this CLM projects being conducted. Then that can immediately lead to improvement, and this may not immediately go to the national level, but at facility level, the actions can be taken, things can be actually improved. There are also even at a higher level change. For example, in Malawi, the sex workers were reporting that they have to show their identity, the IDs in accessing to services, and this has been considered as one of the major barriers. So this being reported up, and then the government are listening to it, and then there were changes in the HIV service provision spot for sex workers. The requirement were removed, so that greatly improved that the good service of those people who are actually needing them. On the health workforce, CLM are reflecting that if the health staff, health care workers are being deployed at the right time, at the right place, and with the right amount. So in that way, if there are staff shortage, which is linking to many things, including a long queue of waiting, and people are dropping off from that continued service, probably due to that they just cannot afford for those kind of long waiting time and all that. So things are being changed, and then even nice shelter are being worked out for those who have to wait for some time, so the conditions being improved. Those are actually also we see that from the community-led monitoring exercise in many places, including, of course, South Africa is the very first and the example that we can always quote. Health information, of course, it's already being referred to. CLM collect information not only quantitative but also qualitative. Let's make it clear: the CLM has never been made or designed to replicate or duplicate what the national or district health information system are supposed to do. But on the other hand, CLM data has been providing its unique value of contributing complementary to the national system data. So in that way, that can help the triangulation and action-oriented the improvement that in a real-time manner, and can benefit the local facility, that's the local service receivers in a very nice way. It helped to improve access to medicine. There are so many examples that let's say in Uganda, the shortage of STI treatment was reported through the CLM, and that led to the system to respond rapidly and then to meet the gap. There are also the good examples from the Democratic Republic of Congo, and with many other countries, we know that this information is useful and helpful. On financing, of course, that will immediately goes to how the data and information from CLM will inform the Global Fund funding request, the COP, the PEPFAR country operational plan defined, and the development and the dialogue. And these are very helpful, and then these are the things that can also inform the national investment. For example, that in Kazakhstan, that the data from CLM help to improve that the Global Fund funding to highlight the need of harm reduction for injecting drug users. And in the Cote d'Ivoire, very interestingly, the CLM information reflecting that the user fees for HIV services has been becoming one of the major barriers, and that of course not for ARV services, but for the OI, opportunistic infection and relevant tests and all that are becoming a major barrier for people to be staying on course. And those will also prompt government to consider that and take action. So there are just so many examples. Hopefully in this webinar, we can listen and hear from colleagues more, and then that can build up our common confidence that to move in a big way in promoting and scaling up of CLM everywhere when there is a need. UNAIDS in general, you see that around the world, in every office, I can say that our UNAIDS colleagues are playing a good bridging role between the community groups and the government, and also the donor support group. That is actually, we are promoting that UNAIDS workforce everywhere to help to harmonize that the different force, I mean, from the different constituency, but make the good use of those kind of once there are funding opportunities, when there is a policy review or defining of the policy directions through the national strategic plan, and so on and so forth. So in that way, UNAIDS are playing is the facilitator's role, and then to help to make sure CLM as well as other great innovations are taking its space, and to be helpful for partners to running it through. We also are offering the concrete support to the Global Fund GC7 activities, of course, through our country offices, through our regional office, through our Geneva office. Somewhere we use our technical support mechanism to process those tier requests. So the colleagues or friends at different place, if you have such a request, please go through our UNAIDS country office, and then to see how much is UNAIDS can support you in this area of work. We can also say that UNAIDS are helping of defining the global guidelines of CLM, clarifying what it is, what it is not. And then they are helping to create overall enabling environment to get better buy-in from donor countries, from hosting countries, from government for this work. And we are producing a global report is on the way. We're also having a plan of setting up a global resource, CLM resource hub, which are trying to consolidate all these many good things around the world for a virtual place where anyone everywhere that can just have an easy access. We are also running on a quarterly basis a community of practice webinars. So those are widely participated from all constituency people. So we will share those information through Pradeep. I mean, hopefully you can help those information can reach to the people who need them. Over.
Gang, thank you very much. It was fascinating to hear you. And most importantly, I think what is reassuring is that what you shared, that CLM actually results in transformation on the ground. And we have seen that in terms of policy change, in terms of investment. You shared several examples. And you also answered another question that I think Valentin in the chat had, which was about how can we integrate the CLM data into national systems? And I know that that's one of the questions that we'll come back to. And we already have another participant, Pomi, who's asking, Pomi Mangla, sorry if I'm getting the names wrong, on how they can access technical assistance for digitization of CLM. And I think the point that Pomi is making is really important, because it's a lot of information gathering currently is paper-based, and CLM data is paper-based, and it's very tedious. So we'll come back to some of these questions, and I would love to bring you and Linda back into the conversation. But what I would like to do is to reflect back on what you already shared about the potential of CLM. Maybe we can look at 3 or 4 examples of what is working, and what has been the experience of digitizing CLM on scale. So let me start with Luazi. Luazi is with Zulu International, and Luazi, thank you very much. I know that sometimes we take several things for granted, including connectivity. And I know you had to drive a distance to find the stable connectivity. Luazi, tell us a little bit more about your experience in digitization of CLM. And you have done this in South Africa. Would love to hear what has been the experience of Communities Matter. What has worked? What are your challenges? How did you address those? Over to you.
Thank you very much. Can you hear me?
Yes.
Thank you very much. Greetings to everyone. Yeah, so there has been an intense amount of lessons learned since 2020 when we were hit by COVID-19, which is when Communities Matters was discussed and thereafter landed in South Africa with the leadership of SANAC Civil Society Forum. And the biggest lesson for me has been the readiness of the country to take up and this was, I think, very like trust unit. It also so that there is triangulation, as Sislinda has mentioned previously, of information, as well as to aggregate information that is received during a pandemic, but also to make sure that the current pandemics are not then therefore impacted by the response to a current pandemic. And that speaks to how we do things now and how we shall do things moving forward. The other big lesson for me has been for countries to, I think, which is a great idea, to have a situation room, which is what was established since then by, again, SANAC Trust, where there is that collation of data, but also you are able to then start speaking around how we use data, how we interpret data, and what data means to different people. Because although we speak about big terms of accountability, big terms of response, big terms of, do we all understand what it actually means in the real time as well? When there is things like floods in KZN during a pandemic, where not only are we dealing with issues of stockouts, but now we're dealing with issues of people not being able to access those facilities. And so CRM allows an opportunity to get real-time data of what is happening in each district, in each area. And we are seeing intersectionalities in all sorts of things, especially the global goals as they are listed. And so climate change is coming into the fore and informing us what is happening on the ground and how it impacts communities and what we need to do to mitigate those issues as they happen real time. But from the people and communities' point of view, which is what you mentioned, the readiness for tools that people use to be able to access Communities Matter. And so I am on my phone now because of load shedding currently in South Africa, because of issues with electricity generation. And this is a national issue. However, I'm still able to find a spot, connect to the network and update it required. Whereas paper-based is just on the nature of how it is. And also paper-based data collection allows you are not being able to respond to issues as they happen. I'm a Global Fund advocate. And so for me, people are at the center of everything that we are doing. So we are doing what we are doing for people, whether it is therapeutics, whether it is vaccines. And so people have got to feel that their voices are heard, but also that there is a safe space for their voices to be heard. And when one thinks of what just happened in Uganda, where a certain general mentioned that certain key populations should not be treated in health facilities, when we take CLM to people's hands and they can immediately report human rights violations as they happen, then we are able to have immediate response, or at least an awareness of what is happening, so that organizations like the Global Fund can be able to have targeted and differentiated funding solutions per country. Thank you very much. It has been an interesting lessons learned, lending CLM in South Africa.
Thank you so very much. It's fascinating to see that energy continues to be one of the challenges when it comes to digitization and digital health. And just to say that as Health Innovation Exchange, we have just recently launched a facility to invest in energy infrastructure, solar for health. So this is clearly, it reinforces for me the need for finding those solutions. But what resonates with what you said is that sometimes challenges come and we need to have real-time information to be able to respond to it. And you mentioned the various things that happened in Uganda or South Africa with the COVID. So for me, my aha moment was when using real-time information when I was still in Bangkok. Young women had been arrested, young sex workers had been arrested, and they were being taken into the police custody. And we got real-time information on that, and we could actually go in and rescue. Otherwise, we all know what happens in police stations with these kind of custody. So I hear you very, very loud and clear on the need for that real-time information. I like the idea of the situation room that brings together the different data. And maybe one of the questions that is being asked, and I think you've already responded, is should we be looking at disease-specific CLM, or should we be looking at integrating HIV, TB, malaria, COVID, different, I think this is from Gabrielle. So what is your guidance? Do you think we should bring all of them together, or do we still have to do it vertically?
Thank you for the question. Communities Matter is integrated. So we made sure that we were, I think, intentional to the fact that each action impacts other actions or thoughts down the line. And so Communities Matters look at the current diseases, HIV, TB, and malaria, but we also have one impact that is specific to TB. There is a need to have specific responses because each community requires targeted and differentiated solutions. And currently, communities feel safe in their spaces as they are currently formed. Whereas in data analysis and data collection and data verification, we need to see an integrated data set that tells us what is happening in each area based on the diseases that we are responding to. I would caution on the quick move towards integration when the current solutions have not shown resilience and robustness. And so we need to learn the current ones, make sure that they work, and then we look at interoperability of the systems. And I think that's more a high need than a one glove fits all. We rather would work towards interoperability than to work towards just one tool currently. And so I would caution towards being, I think, patient, working that the systems work perfectly, and we understand how we collect data, and that all countries do have data protection for communities. And that's key, again, a key lesson, because we need to be aware that the minute you start collecting people's data, certain people start using that data inappropriately. And so South Africa has got personal Protection of Information Act, POPIA. Other countries don't necessarily have that. And so we need to pace ourselves and understand what is the climate currently in each country. I hope I have successfully answered that question.
Thank you so much. No, it's absolutely spot on. We need the specificity that is needed to be able to act and also to protect the rights of people. But at the same time, we need to also be able to bring together the different data sets to look at it. And that goes back to your situation room question. Thank you so much. And I really appreciate you driving all the way to find the hotspot and connect. Appreciate that. Let me move to Georgina. Georgina, I've always said this, it's always fascinating to speak to you because you always have so many really insights on what works, what is needed, and also your vision of looking at empowerment and taking a long-term strategy. It's something that I've really admired. So I still remember having a conversation with you several years ago, talking about how can we collectivize communities and bring in the power of people living with HIV to transform policies, because if 20, 30 million people come together, that's a huge, huge, powerful group. So, and you've been one of those advocates for digital transformation. From your perspective, and I know that GNP Plus has done a lot of work in looking at digital and CLM, you've led much of that. And also you're one of the award winners for the Voice Plus platform. So would love to hear more on what's been your experience. What are the challenges? What are the areas of caution? And where are the areas that we should be pushing the boundaries? Love to hear that, Georgina, and thank you again for being part of this conversation.
Thank you so much, Pradeep, for for involving us in this discussion about digital CLM. So for everybody else, my name is Georgina Caswell. I am with the Global Network of People Living with HIV. I'm also in South Africa, in Cape Town, where we are indeed struggling with with internet-related issues, electricity. So GNP Plus, we have a digital tool, and it's an app. It's called Voice Plus. And we've been on a journey with Voice Plus. We're developing it with Dure. We've developed it with Dure Technologies. And we've also had the financial and technical support of UNAIDS. Pradeep and his team a couple of years ago helped us kick this off. And the Global Fund Community Rights and Gender team, WHO, UNICEF, and other partners. And like many other tools, Voice Plus also started because of COVID-19. And COVID-19 drove us to develop the app because we wanted to find a way to ensure that networks of people living with HIV had access to accurate and the latest information about HIV and COVID. We wanted networks of people living with HIV to connect with each other and to be able to share some of the real issues and some of the real kind of challenges that they were facing. So we held consultations with national networks of people living with HIV on the pressing needs during COVID-19. And we heard things like that there are not enough channels to raise some of the emerging trends affecting the human rights of people living with HIV, that there was too much misinformation on various health topics affecting people living with HIV, and more so with COVID at the time. We heard that networks felt that there were limited and shrinking spaces to kind of connect and to learn from each other. So Voice Plus is, a digital app, and it connects people in networks of people living with HIV. It's for information, it's for discussion, and it's for reporting for the purposes of advocacy, as Pradeep mentioned. Users can access, therefore, the latest information about HIV and related issues, and they can report their advocacy challenges to GNP Plus through the app. And this then prompts a response from the Voice Plus team at GMP Plus. And because Voice Plus is also about learning and sharing, we have also enabled users to actually report the advocacy successes as well. We designed Voice Plus with users in mind, and the app has changed a lot as a result of feedback from users. Last year, we introduced more content categories. So that includes like the latest news, opportunities, even funding information. We have a health-related partner, Avert, they are our content partner. We also changed the design of Voice Plus to make it really like nicer to look at and easier to navigate. And this year we also introduced the registration of users to respond to some of the concerns about privacy and to really enable a more sort of individualized kind of experience. So unlike what Luazi said about a tool that or a program that collects information about people's individual experiences, Voice Plus is a bit different. So it's about, it's for networks to be able to ask for help to figure out how to respond to CLM data. So for instance, if the CLM data is showing that people aren't being given the information about treatment that they are taking, this is the place to raise those kinds of issues. It's also the kind of place where we've seen networks report that they are really struggling to find and fund their own office spaces, because without it, they don't have safe spaces to meet and work. You can even find information about GC7 on Voice Plus. So yeah, so it's a space where you will see the emerging trends that come out of CLM data, and it's a space to really encourage the use of the data for advocacy. What have we learned in terms of wisdom for digital CLM? There are 5 things to share with you. We've learned firstly that community leadership and the meaningful engagement of people living with HIV must include considerations of whether and how to use digital technologies in CLM. So it's not possible to develop a whole CLM, digital CLM platform if it isn't done through a process of co-creation. Communities must be meaningfully engaged in the design, in the implementation, in the monitoring of digital tools in CLM. Secondly, we've learned that when it comes to sustainability and ownership and security, that these are really central to decisions on whether and what kind of digital tools to adopt. Security and privacy was a really big issue for the users of Voice Plus. And that's why for us, our users must register and must be approved before they can actually participate in the interactive part of the app, because we needed users to feel safe in the same platform that they are basically reporting sensitive issues. We're also part of a digital health and rights consortium, and we've done research in this space. We've really become a lot more alert about data protection, privacy, and confidentiality of information. And so this led us to really revisit the initial Voice Plus app for further security improvements. Also for security, like our push notifications are very carefully worded, and even the logo and the design of Voice Plus does include icons that we associate with HIV. As a third lesson, sometimes it feels like Voice Plus will never be finished. And it's tempting to think of digitalization as kind of limitless, because technology can basically do anything, but we all have access to limited resources. We've got limited time. We're quite stretched in all that we're delivering. So we have to be careful to consider where to invest our limited resources. So it's important to really consider the boundaries of the digital tool at the start and really to stick to your objective. Fourthly, we've learned that just because you build it, it doesn't mean that users will adopt it. It takes time, it takes promotion, it takes visibility, resources, and people to ensure that your users actually engage with the tools that you're building. And of course, it must meet a need that they have. And it's important to be constantly reevaluating, is this tool meeting the need that we had in mind from the beginning? And then finally, just speaking to the point that Loazi was speaking to in terms of readiness, and in terms of readiness to adopt digital tools, from what we are seeing, all networks of people living with HIV can adopt and use appropriate digital tools if there's the right investment. So what needs thought is more how ready is the Global Fund and how ready are other technical partners and donors to fully support communities and networks to actually be able to use digital tools, and how ready are countries and other players to ensure that the digital tools that are adopted are actually the right ones from a security perspective, from a data perspective, from a process ownership perspective, and also, to be honest, from a sustainability perspective. So those would be the words of wisdom for you, Pradeep.
Amazing, amazing. I really like I mean, it's fantastic to hear your experience and the journey that's been ongoing for a couple of years now. And it's great. It's always refreshing to hear what's working and how the need for any of this to constantly evolve and adapt. I know you said technology is limitless, but the demands also keep evolving. And how do we evolve and respond to that? But I really want to touch upon one point that you made, which is that digital transition for communities on data and beyond requires investments. And we certainly need to make sure that, of course, we heard very loud and clear from Linda that Global Fund is committed. We heard from Sungang that UNAIDS is committed to do that. But I also believe that we need to be bringing in a fund that is managed, and it's a catalytic fund that is managed by the communities, which can invest where it is needed, provide all the flexibility that is needed, which is quick and easy. And that's something which it's a very clear call from what I hear you. And I know that I saw Nomtika has a similar question in terms of, do we have tools, resources, funding? And maybe we can bring in Nomtika to ask the question she has in a minute, but would love to see how we use our collective wisdom to drive that transition, because that needs to happen because of all the benefits that you and Loazi and others have spoken about. But thank you. That's always encouraging to hear and great to see the progress made. Thanks very much, Georgina. I'm going to move to Indonesia. Jacqueline, thank you very much for joining us. And really, Jacqueline, you work with the international, the Indonesian AIDS response. And you have been really, I'm trying to do two things, which is I'm adding you into the spotlight so everybody can see you rather than me now. I think I would love to hear a little bit more about how you are, your work on CLM with key populations in Indonesia. What has been the lesson? Where do you see the value of digital in that? And also as a Global Fund PR, what is the process by which you go into that transition in CLM to digital? Over to you, Jacqueline.
Yes, thank you. So I'm from Indonesia AIDS Coalition, which is a community-based organization that we are working to fulfill the rights of people living with HIV and a key population. And actually, the community-led monitoring practice that we have done actually was born from a social media group. It was born from a group discussion that we called the Oda Berhak Sehat, which literally translated into people living with HIV has the right to live healthy. And this is a group where people living with HIV and key affected population can discuss and talk and you know, just share everything in a safe space. So in this space, actually, we collected a lot of information that inspires us to formally form a community-based monitoring and feedback mechanism. So as you know, that Indonesia is a very vast country, so we try to firstly introduce this community-led monitoring mechanism in 23 districts, which, you know, monitor the health communities, the service providers, and all. And what amazed us is that there are a lot of significant changes that we have by collecting the data from this CLM. For example, in 2022 alone, we have 212 data from health service providers that can be responded through this CLM mechanism that we had in district level. So this CLM mechanism also inspires a lot of evidence-based advocacy that eventually led to significant changes. For example, the 2020 ARV price reduction and the adoption of TLD in Indonesia HIV treatment, and also the most recent, the condom stock out in a lot of health service providers. So data and information from the community works really well if we can manage and we can bring it into a national advocacy platform. So that's what we have been doing with the CLM in Indonesia. And of course, right now we only cover 23 districts out of 514 districts of Indonesia. You know, Indonesia is a very big country. So we are looking to scale up this CLM mechanism through this next G7. So this scale up will, you know, rely upon the digitalization of CLM reporting. Like for now, we only have this social media group, whereas the verification will take a long time. What we want is to have a wider and more secure, like Georgina just said, we need a secure platform. So we would like to have a platform of CLM reporting and response mechanism. So what we are trying to do in the next what we are proposing is the digitalization of CLM reporting and response mechanism. So to do this, we actually have started building the infrastructure and feedback mechanism, because as you know, there is no use report if we don't respond to it. So we have built the infrastructure, we have built the feedback mechanism in district level, in national level. We did advocacy, you know, to ensure that the government buy in our mechanism. They believe that our data and information is reliable and they can use it to make the necessary changes. So this has been done in the national level. So when the digital platform is ready, we already have the verification mechanism and the response mechanism, you know, to respond to the reports from the community. So what can we learn from this is that we really, like Georgina also said, that we really need a participatory process. So the community has to be involved, engaged in all steps of the development. So we are building a platform that the community really need, that meets the requirement and the needs of the community, and also can be accepted by the government. Also, we need promotion and support from the community themselves. We already work to promote the CLM awareness to the community, but we would like them to also know and want to engage through the platform. So the platform will not just become a platform, but there are people actually use that to, give information and give data that we can use. So I think that is all. Right now, we already have support from the government. We already have support from the community, especially the national networks. And we are looking towards an optimistic digitalization of the CLM platform that I believe that will, have better impact than we have now. Thank you.
Thank you very much, Jacqueline. It's always looking at the scale that is needed, and you mentioned you're in 23 districts out of 514, and Indonesia is 15,000 islands or more? 18?
Roughly 18,000 islands.
18,000 islands. So it also really is about scale and bringing that connectivity where communities, wherever you are able to access information, services, provide feedback. And what's also heartening is to hear that the government recognizes the value add of CLM. So that's a great story to hear, and all the best with that journey of digitization and scale. Thank you very much.
Thank you.
I'm going to invite Sabyasachi. Sabyasachi Das is from the private sector, but he works across 40 plus countries, is focused on real-time information, and has been able to really build solutions that are relevant. And in innovation, we call it the co-creation process. So Sabya, from a technology perspective and from your own experience as someone coming from the technology side, how can we look at the lessons in scaling? What has worked? What has been the journey? What does it look like? And if you can speak in a non-technical language that someone like me who doesn't understand technology can understand. Tell us more about your journey, what you do.
Thank you so much, Pradeep. Just in a way to introduce myself, I represent Dure Technologies, and we have been supporting various digital CLM platform across 40 plus countries, like Pradeep mentioned. We have been working with 100 plus CLM partners. So a lot of the experience and learnings that I'll be sharing today is sort of a collective learning from all these countries and all these partners. So if I may just project my screen, and I'll try to make it as non-technical as possible. So just to share some of the learning or our experience in terms of how the CLM data space has been evolving. I hope everyone can see my screen, right?
Yes.
Okay, perfect. So I think one of the major shift that we have witnessed in last a decade or so. So we have been implementing CLM, data CLM with UNAIDS and various other partners for last 1 decade. And we have seen a huge shift from the CLM data being used, merely as a reporting purpose to actually, to take action on the ground to respond to the community needs. So one of the transition is to move away from a conventional survey-based model, which happens, once a quarter, once a year, to a more routine real-time data collection, which I think Luazi also highlighted in his talk. And not just real time, but data getting collected from the source at the last mile, which means the affected communities, the people affected with TB, HIV, malaria, are able to now directly participate in these data collection process, where they can voice in their challenges directly through these different digital tools. The other shift that we have witnessed is that now it is more and more response focused. So it's not just collecting data, but it's all about also responding to those data. So it's really using the data for the benefit of the communities. And that's where we have seen a huge shift. There's also a major shift that is happening. And when we heard from Georgina also through Voice Plus, which is not just a data collection tool, because whenever we talk about the conventional CLM, digital CLM and CLM data, we always talk about data collection, but there is a much more holistic approach of engaging with the communities, building trust, and really supporting them through the entire journey. So we have seen shift of lot more than just a data collection in terms of creating community forums where people can exchange ideas, get supported by other peers, or conversational AI and different innovations where they can get 24/7 help desk, psychosocial support to sort of make their journey easier. Apart from that, there's also a lot of focus on the data use. Like I mentioned, that it's not just data collection part, but also how you make the data actionable. So, for example, can I see how stigma is influencing the programmatic outcomes such as treatment discontinuation or viral suppression and things like that? Can I do something about it to reduce stigma? So the data has to be much more actionable than just data for reporting purpose. And I think the last one is what we are seeing is CLM, digital CLM, and CLM in general is getting more and more mainstream. So it's not seen as a one little cute project on the side, but it's getting mainstream within the national data ecosystem, and which is also aligned with the RSSH objective of the GC7. So we are seeing a lot more mainstreaming in terms of data integration, interoperability with the national systems, but also not remaining, each program remaining in silos, but really, which again, Georgina and Wazi mentioned, that having a more holistic approach where different programs, are integrated. So it's not just TB or HIV or malaria or mental health, but these are all integrated because that's the human-centric approach, because the same person can be affected by different challenges. So based on all these learnings, I think we have just tried to put together, all our learnings into what could be the possible model or, that can be implemented by the PRs and the community stakeholders in the country. And this is, again, just a very high-level overview, and this has to be co-created, co-conceptualized with the country CLM partners. But this just provides a very high-level, sort of guidance on what could a comprehensive digital CLM platform might look like. So one is really support the data collection and engagement process at the last mile, not just a survey like I mentioned, but really where the communities can directly participate in the data collection process. One of the challenges that we have seen in past is really to reach out to the most vulnerable communities. So how do you actually maximize reach to the most vulnerable communities? And again, going back to Linda, that no one should be left behind. So there are now different mechanisms to really maximize reach to the most vulnerable population. By obviously one of the ways are to provide access to these tools via multiple channels. So not just a mobile app, but also social media, which a lot of people are already using, be it WhatsApp or Facebook or Viber. It could be non-internet based channels. So it could be USSD, SMS, or in some cases where the CLM partners are already collecting data through in an Excel sheet or a call center. All this data should become the source which we can use and leverage and analyze to really take evidence-based decisions. And like I mentioned, that it's not just about data collection, but there's a lot of other engagement modules which can be considered, starting from social behavior change and risk communication. It could be reporting. Obviously, one of the core aspects is reporting barriers to access to HIV, TB, malaria services. Community forum, which basically could be a sort of group chat where people can exchange ideas. So it's really community led and not just one-sided. They can have, we can use a lot of, digital innovations like conversational AI, natural language processing to really provide a 24/7 support to the affected communities. Near me functionalities where they can, find out the nearest access center, be it DIC centers or testing centers, counseling centers, etc. And they can also participate in community-based service. And this is just, a few examples. And like I said, this has to be co-created and co-conceptualized with each of the country CLM partners. And once these data gets collected through different channels, this can be used by different stakeholders. So one stakeholder is obviously the first responder who can respond to these challenges on the ground. At the same time, the policymakers like national programs who can use this data to make better policies and decisions. Just from as a digital health provider, there are few consideration I'm putting forward in terms of GC7 inclusion, based on our learnings from 100+ CLM implementers. The first one is to consider a platform which can be can be configured based on the community needs, which means because the community needs are constantly evolving, so the platform should be flexible enough so that the country stakeholder themselves can keep adapting the platform. This is essential because from a sustainability perspective, that this is completely owned, managed by the community partners in the country. The second, like I mentioned, that to have a very, very comprehensive CLM dashboard, not just for the CLM implementers, but also for national programs. It has and it's also can triangulate with other data systems, like I think Pradeep also highlighted. It has to be open source because the entire ownership has to lie with the countries and the CLM implementers in the countries. To maximize reach, we should consider multiple channel, not just a mobile app, but social media and other channels. It should also integrate and be interoperable with the existing data information systems within the countries and align with the digital transformation vision of the country. That also includes data privacy policies and other security guidelines. And the last one is to consider one of the learnings we had is it's very easy to develop a digital tool, but the real challenge really lies in scaling this up and disseminating and get this adopted by the people who really need it. And again, going back to Mrs. Linda, one of the things, the philosophy is really to not leave anyone behind. So I think to really considering the operational part of it, that post the tool has been developed, how do you scale it up? How do you disseminate it to the affected communities will also be very crucial. To support this endeavor, we have also been will be running a lot of digital CLM clinics where we will be discussing more, sharing more information, sharing a lot more our learnings. So we can be reached out on digital CLM at Dure Technologies and or on WhatsApp. And there'll be a series of consultation and assessment and orientation which we can go through, starting from sharing global best practices in the digital CLM platform, also sharing live demonstration of some of the widely used CLM tools out there, share tools to actually include digital CLM within GC7. So there are already templates which are published by Global Fund and HIEx and other partners to include digital CLM. So we will also be able to share more information on that. And also we'll be happy to help in terms of conceptualizing, creating write-ups towards inclusion of digital CLM within GC7 and including the costed plans. So I'll be very happy to hear more from other participants. We'll be very happy to respond to your questions, and we're really hoping to interact more through this channel. And these digital clinics will be done in joint collaboration with Health Information Exchange. Thank you, Pradeep. Thank you, everyone.
Sabya, thank you very much. It's really interesting to hear the summary of experiences across the countries that you work with. I know we are running a little bit behind time, so I'm not going to go into some of the details, but I think what would be really important is today we have had so many presentations. Each one has highlighted some aspect of CLM that we need to take into account. So what I'm going to do is to see if we can follow up with many of you to pull together some of those lessons. And I think it was Gang who said about pulling together a community of practice, a resource that can be accessed by everyone. And for those of you on the panel who have not followed the chat, there are some amazing comments and questions and suggestions. Some of you have fan following already building up, so there may be emails coming your way from others. So please do go through that. Now, what I'm going to do is the last phase of this conversation. I want to really go to some of the people who have a critical role in supporting this process at the country level, regional level, and global level. So I'm going to ask Dr. Leo Zeking, who's the head of UNAIDS in Nigeria. Leo, thank you very much for being here and for being such an advocate on engaging communities and bringing in that participation, the partnership between civil society, governments, policymakers, and investors. So you've heard so many of these experiences. Now, what needs to happen at the country level in terms of supporting this transition to digital when community groups want to go in that direction? What's your experience? What's your guidance? How does UNAIDS support it on the ground?
Well, thank you, Pradeep. For somebody, I'm Leo Zeking, sitting currently in Abuja. You've mentioned that I've been in the process for quite some time, but for somebody who has spent almost 35 years in the AIDS response, different levels, so seeing patients at the hospital, so moving from Zidovudine, and then now seeing DTG, TLD, and so on and so forth. I'm really thrilled to see, I would say at long last, that we do recognize that without the communities, so there's no way we can make it. During my entire career, I've advocated, so that a response was too medicalized, so, and I'm really very happy to see UNAIDS, Global Fund, PEPFAR, each and everybody, so talking about community-led responses and then community-led monitoring. So I'm really very happy. Also very happy to see online some of the friends from Ghana, Cecilia, friends from DRC, Cameroon, Congo, Nigeria, Tanzania, where actually I was UCD for 2017 to 2022 before moving to Nigeria. So that's where we started, so community-led monitoring in Tanzania, and also we're supporting the process here. Before I go into what has to happen, Pradeep, with your permission, really for those online, really re-emphasizing what Gang said. As UNAIDS Secretariat, at UNAIDS joint team at the country level, we're fully involved in the process, so of the proposal development and funding requests. And as we speak, Nigeria, so it's in that process for window one. And we are also part of the country dialogue. So what we bring into the conversation or in the process is at least three things. Ensuring that we facilitate the process by which community will recognize and make community-led monitoring a priority. So it has happened, so it's happened. The second thing we do, it's really a lot of advocacy to make sure that community-led monitoring is a priority. And we're not inventing it. I'm sure many of you are familiar with the global AIDS, strategies. So it's in there. It's a key area. So just making sure that countries and communities who have contributed, making sure that it is recognized that those areas, features they're taking into consideration, doing that advocacy, so it's extremely important. Engaging with government in such a way that we can have the buy-in, it's something which is really very important. And then the third thing is, you've mentioned it, providing the technical support, so in such a way that whatever proposal we are writing, the CLM component. I want to acknowledge my colleague, Gabrielle. You mentioned Gabrielle, who is a community mobilization and net in the UNAIDS office, really sitting with the community to ensure that the community-led modular, so meets the requirement of the Global Fund. Submitting a proposal is only a step in the process. There will be grant making, okay? There will also be grant implementation. So Pradeep, from where I sit, so what should happen? I think four things for me, four things need to happen. Whether we like it or not, it's about the money. The funding, it's important. And I want to challenge GNP Plus. I want to challenge all the networks who are in this call, so to do the necessary advocacy in such a way that we can walk the talk, that the resources, which most of the time are commodity driven, the grant are commodity driven, so that the resources can be allocated in such a way that we can effectively implement community-led monitoring. In Tanzania, we did it was at a pilot. In Nigeria, we did it as a pilot, so 21 states out of 36 plus one in Nigeria. So we really need the funding in such a way that we can go, so to scale. We can really go to scale. For me, it's not negotiable. And UNAIDS will be happy to play its role in that process. The second thing that we need is technology and infrastructure. I will agree with you that infrastructure means many things, access, connectivity. So we really need technology and infrastructure, especially when you talk to the people who are down on the ground. One of the main challenges that they do face is the timing, so to collect data, but more importantly, to analyze and visualize those data in such a way that they can do the engagement, the co-creation, the advocacy, and then monitor that. So the technology and the infrastructure is key. I'm happy to see that Dure Technology is having something, so really very simple and then straightforward. The third thing that I really think, Pradeep and colleagues here on the call, I think we need to go beyond the quantitative data to include some qualitative data there. I will even suggest, so the client satisfaction. So there's been conversation here and there. Is it integrated in terms of data, or is it disease specific? And then we'll make sure that the platform can speak to each other. So whatever we want, at the end of the day, what is important for me, it's that data should be transparent, and then whoever people can have access to those data. And the fourth thing I really think is, how do we go beyond data analysis? And many people, again, will tell you, that we did the data analysis, we did the co-creation, but unfortunately, we were not able to do enough engagement. We're not able to do enough, advocacy for the policy change, and also to be able to monitor the changes that has happened. And for that to happen, Pradeep, we need the knowledge and then the capacity. So I want to suggest, so in sharing my screen here, only on one slide, I really want to suggest here, can you see my slide here? I want to suggest, yes. I want to suggest here, I'm trying to, okay. I want to suggest here that when we're looking at capacity development, so it's really holistic. We need what is strategic here. Those community needs to be able to do strategic planning. They need the capacity, so in terms of governance, should they have those grants, they should be able to govern those grants. They need leadership. They need communication skill in such a way that they can advocate. They need the capacity to fund, so the resources. So capacity, so at the strategic level, capacity at operational level, so in such a way that they can hire the resources, it can manage the resources, it can administer. Of course, you've mentioned infrastructure here, is really key. And in such a way that they can monitor the performance, so if duty barriers commit to something, they need to be able, so to monitor those performance. And then lastly, they need programmatic capacity here. I will stop here, but again, from where I sit, Gal and yourself mentioned some of the power of community-led monitoring and then the advocacy, so here and there. I will agree, I would not argue, but I think it's still a full potential that has not been unleashed. And we need to do everything possible, so to unleash that potential, so at the community level, which is of course independent and then led by the community. There's no doubt about that. And there's a saying that if it is for me, without me, it's against me. So I will end here. Very excited and then very happy. They're looking forward, so to future conversation. Thank you.
Thank you. Thank you very much, Leo. Everyone, I'm conscious we are running over time. I'm really, really sorry for not being able to manage it better. We have two speakers who have some really valuable lessons. One is Muleva Onesimus, who's from IANASO, and we have Marilyn Mireku from AIDSpan Global Fund Observer. I'm going to bring them in and request if you can spare us another 10 minutes for us to go through the two presentations. There are some amazing questions that are there. I'll summarize at the end, and I want to make sure we have a way of coming back to those questions and finding answers. But let me invite Muleva. Thank you very much for joining us. Would love to hear, as a regional network, what support can partners expect from you? What has been your experience in looking at CLM and the whole advocacy and making changes in policy that you have been driving? Over to you.
Thank you very much. And I'm really cognizant of time, and I think my predecessor speakers have really talked quite widely about the value of CLM and what we are doing. I think what I just want to quickly say, and I'll not spend much time, the story remains all the same. We need investment in CLM, and especially when we are talking about digital CLM, because there are only two. I like saying there are only two ways to do this. It is digital CLM, and the second thing is digital CLM, because the world is shifting and we are moving to the digital era. There is no it can remain. It definitely has to be digital. And for us to do this, we definitely need to ensure that the right investments into digital CLM are actually made. We have had quite a series of engagements and meetings on CLM starting from last year. We went Bangkok, bringing all CLM global leaders and communities to simply say, what do we need to do? And I remember in Bangkok, we came up with a very strong call to action that there is need to significantly invest in CLM so that we can really number of benefits why it is important to actually shift our gears to digital CLM, and we have seen it in the region. And I'm not just going to go through what everybody else has said, but the quick over response is one of the key benefits of digital response, because once information is actually shared in real time and real action is taken at the right moment, then the benefits thereof are quite immediate, and this is quite useful. We cannot achieve this in any other way than ensuring that CLM is digitized. We are talking about could quickly pick these reports, briefcase reports, and actually make very useful decisions out of them. Of course, the quick analytics that is brought about by technology is a big plus. And of course, where digital CLM is adequately privatized, creation of user rights, it actually offers the comfort of communities to feel so secure that they are not interacting with anybody face to face. They are actually obscure, and they are actually able to present their issues knowing that with really watertight user rights, then their data actually cannot be tracked and probably ill things to happen. So all I just want probably to say is irrespective of the potential threats that people have actually talked about, including sometimes infrastructural challenges. We know that Loazi had to really drive very far to get internet connectivity. It is the way to go. There will be these challenges, but I think as we move on to digital CLM is the way to go. We have seen the fruits that are happening. There are so many digital platforms right now actually ongoing. Sabi just talked about a whole range of these platforms that is supporting. And all these are actually useful in our space today. All I would actually reiterate again is let's lubricate the CLM engine with the right oil, which is actually effective and efficient funding for CLM. Thank you very much. I would have talked much, but I know we really are constrained with time. And as a digital and as a regional platform, ENASO always works with communities to actually connect communities with technical partners who can actually be able to provide technical support on CLM as of when they need it. Thank you very much for listening to me.
Mleva, thank you so much. I think you took less time, but you had a very powerful message that we need to make use of this opportunity. We need investments. We need to maximize, and we need to define the rules of engagement rather than be taken over. So fantastic. Thank you very much. I'm going to go to the last speaker for the day. And for me, really, Marilyn Mireku, thank you so very much for joining us. The Global Fund Observer has been, right from the day Global Fund was set up, for me, it has been the source of intelligence, inspiration, and information. What I want to come back to you is, where do you see the information available? What are the processes that are ongoing that you are aware of? How can we make this kind of call for digitization and the call that Mleva made? How can we bring that to the larger audience? How can we make sure that we have financing available? Certainly the Global Fund is doing its share, but also maybe can we look at a broader access to resources? So Marilyn, over to you.
Thank you, Pradeep, and thank you, everyone. So I'm also going to be short. I hope I'll be able to answer your question. So HIEx, we do conduct independent observation on the Global Fund, and we have also been doing this for 20 years now in Africa and other countries in the regions. So as you've given us, Pradeep has given an introduction, our work has mainly focused on being an observer for the Global Fund, but over the years we have continuously enhanced the effectiveness of the Global Fund by strengthening the accountability to the fund and also engagement with stakeholders. And due to that, we have actually responded to the need by stakeholders to observe other GHIs beyond the Global Fund. So we have changed our strategy in the next 5 years. We'll not only be observing Global Fund, but also into other global health initiatives. So generally, just as an overview, the activities we engage in, we conduct independent observations of donor processes at global, regional, and country levels as national level. And we also evaluate Global Fund, like we'll be doing that now as it expands its mandate in this next strategy period, is the GC7. And we'll also be engaging country structures in enhancing accountability for funds. We've also been disseminating information at the global, regional, and country levels, just to highlight the voices of stakeholders, that's both the implementers, the beneficiaries, to influence desirable change in implementation. So how we do this work is we mostly collaborate with us, we also collaborate with the implementing countries and beneficiaries, just to coordinate efforts at enhancing the effectiveness of accountability and transparency of GHIs. So from the brief overview I've given, you can see that collection for monitoring the effectiveness of grants is actually at the heart of HIEx's work. And that's why we partner with national governments and beneficiaries to achieve our goals. In terms of support that we provide, we have been providing guidance to programs in ensuring the effectiveness of CLM. Like there's been a question here about how do you go beyond data collection and how do you even collect strategic data. So we have responded to calls to support programs in communicating for change as part of their monitoring efforts. Here we have provided guidance on what to do with the data or information gathered. From my experience, most programs collect monitoring data and information, but they usually need support on how to influence change, especially at the national and global levels. So we have opportunities for partnering with interested programs and individuals for policy advocacy and also for change at national level. We have also worked with communities to collect and analyze simple data for decision making to influence change. We also support in providing guidance on what data needs to be collected. For example, what are the risk areas? How do you identify risks that need monitoring? How do you collect information the community can use to influence change? Do you need to collect data to improve information for decision making? Do you need to collect data for sharing news and information? It could be between individuals, within communities, or between communities. And also sometimes just partner with communities to collect data for triangular observations. We also provide guidance on how the community can engage with stakeholders and identify the relevant stakeholders, that is in monitoring efforts at the various levels of implementations, from the community level all the way to the donor level. And from our experience, it is usually important for stakeholders to view the monitoring efforts as useful, that is from the community all the way to the donor, so to understand the tools that you're using for data collection, since it's important in enabling them to deliver on their responsibilities. For example, they need to take into consideration how the feedback loops would operate in terms of effectiveness and also ensuring efficiency. Also, we've also supported programs on how to build trust between stakeholders, because collecting, monitoring information and communicating out there, there has to be trust between the stakeholders. And stakeholders here, I mean donors, the national government, service providers, and communities. Since, like I said, this is very important in monitoring. Like, how can programs enhance transparency? How can they be consistent? How do you prevent bias? There was a question here of how do you prevent bias in CLM? And how to ensure that the CLM efforts are considered independent or without bias. So from my experience, just to put this into context, the implementers should ensure there is analysis of factors and work together with stakeholders in identifying mutually satisfying solutions. We are also a convener of other partners in the observation role. So we hold workshops for learning, for shared learning, and also how to enhance data use. So we continue enhancing effectiveness of grant implementation also by reducing health inequities. And we look forward to expanding these partnerships to enhance effectiveness of our grant implementations in the various countries. Thank you, Pradeep.
Thank you so very much, Madeline. And maybe one quick ask of all the panelists. I'm going to request you if you can have your video on now for a group photo. But while we do that, two quick things. One is really a huge really gratefulness for being part of this conversation. Truly appreciated. And I know many of you have gone through the hoops to be in this conversation. Really appreciate that. Number two, to all of you who have been participating in the chat and asking questions, providing feedback, comments, encouraging the panelists as they were speaking, I really want to say a huge thank you. And I really have failed in my duty to bring you in and the questions. I know that many of you answered the questions, but here's what we will do. We will make sure that we take those questions, we respond to it, we provide you the feedback, which we will share widely if that's okay. And the comments, if it is okay, what you have provided, we'll use that in our learning. 3 practical actions. 1, of course, we'll answer all the questions to the best of our ability, drawing on the panelists and their and the information that they shared. 2, Sungang, I think Sungang mentioned about the need for bringing together a community of practice, bringing together the expertise and experience together. We'll start playing a role in facilitating that, and maybe reach out to some of you to think through some of those processes. How can we do that? 3, there's a very clear call for investment. And one of the things that maybe as Health Innovation Exchange, we bring together investors from the public and private sector, so from development financing institutions, private sector. So one of the things that we will certainly be looking forward to is bringing together some investments in helping that digital transition for communities in CLM. So those are the commitments I have, but this has been such an amazing experience. For those of you who want you have any questions, you want support in that transition, want to think through how you can be supported through the GC7 process, please feel free to reach any one of us. I know there are so many people with so much expertise. If you want the Health Innovation Exchange to play a role, please send an email to digitalclm@hiex.ch, and we'll make sure that it reaches the right set of people to bring that expertise and to share with you that experience. But thank you so much. It's been, to the panelists, absolutely amazing. The insights have been so amazing, and it's the power of that conversation. We want to learn, continue to learn, and we'll be coming back to you. Thank you for being part of this journey. To each one of you, thank you. Have a great, great, great day. And to the interpreters, thank you.
Thank you.
Bye.
Bye-bye. Thank you, Pradeep. Great. Bye-bye.
Thank you. Bye. Bye.
Denise, how are you, Denise?
Luazi, thanks. Take
Okay.
care. Safe drive. Bye.
Bye.
Bye, Leo.
Bye, 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 bye.